A year ago today, in March 2020, Ghana recorded its first 2 cases of COVID-19. At the time, many of us were afraid because even the rich and powerful nations, China, Italy, the US, the UK, were still struggling to understand this disease. And we knew then that if we started recording cases, it would just expose the challenges that we have in the health sector. Thankfully, a group of business associates forming the Ghana COVID-19 Private Sector Fund were also thinking about what they could do for the country. In the end, they settled on an infectious disease and isolation treatment center, and they had a record time of 6 weeks to complete it. Well, in the end, in collaboration with the Ghana Armed Forces, we had this infectious disease and isolation center still in a record time of 12 weeks. As a proud ambassador of the fund, going around and asking for monies from fellow Ghanaians with as little as 20 Ghana cedis to contribute to finishing the project, I have come back as we observe the 1-year anniversary to look at how this structure has helped in the fight against COVID-19.
From the dawning area, we proceed to go and do our work. So this is the patient area, and our doors are controlled so that you can regulate the flow. Okay. So once you enter in here, this is the patient area. The building is negative controlled, negative air pressure controlled, so that the air from the corridor does not mix with the air coming from inside, so that we are safe to walk around here. Okay.
I see that you have the fund team. They're almost always looking at you, but do you still get support from the fund after they put up the infrastructure?
I must say that they didn't just set it up. One thing we know is that they are setting up a maintenance fund to help us maintain the place. And when we had issues with oxygen, they were quite supportive in getting us oxygen. So they've been there from day one.
It's good you mention oxygen. How much of it do you use?
Our main drug here is oxygen, because people are on, let's say, 15 liters per minute per 24 hours. So in a day, just about 10 patients, we use close to 80 cylinders of oxygen a day. Yes.
Okay, just for the records, this was supposed to be a 100-bed facility. Is it still a 100-bed?
It's still a 100-bed facility. To make a facility functional, we needed to convert some of the beds into other things. So we can't say that we are running on, let's say, 80 beds at the moment.
Okay.
But we are not running the full 80 beds. Running the full 80 beds will mean you will need more oxygen. Running the full 80 beds will mean you need more staff. So we're currently doing just about 2/3 of our capacity.
Okay.
During our peak periods. I must say, currently we are in our lean periods. Okay. Our numbers have dwindled drastically.
Okay.
Maybe we are waiting for the 3rd wave.
Well, hopefully we don't get there.
Hopefully.
We pray against anything like that.
I pray all of us will just stick to the protocols and we don't have to do a 3rd wave.
Yeah. But is this a referral center? How do you come here?
Okay, so once you are diagnosed with COVID, this is for managing severe and critical COVID. Once you do not have severe or critical COVID, you just can't walk in here. We need to know about who is coming, and we need to plan for that particular patient. So that if you get COVID and you just walk in here, you may be turned away. And somebody will say that's cruel. But we have a COVID OPD. So if you go to the COVID OPD and we see you and we think you are mild, we can follow you up from the house. If we think you need to be on admission, you are admitted. If you're coming from another facility, there's a system in place where patients are referred to the Greater Accra Regional Coordinating Team, and then together we distribute the patients to available beds. When it has to do with severe and critical, apart from this center, Kolebu also helps, 37 also helps, Nyaho helps, and Ridge Hospital. So depending on where you have available and functional beds, we may move you there.
Okay.
This is the area where a common area for all of us. Okay. So this is the nurses station, nurses and doctors station. To my left, you have the wards. So we say this is the severe area. To my right, there are wards, but this is for those who are recovering. Okay, and towards the east, we'll be moving towards the intensive care unit. This is the pictures of the project team. So we have a mix of architects, surveyors, doctors, biomedical scientists, photographers. These people made the funders brought the money, and these people made sure that it was a success. Okay, so this is the intensive care unit. The intensive care unit has 21 beds, 5 for critically ill patients and 16 for severe to critical ill patient. We say critical when the person is on a ventilator, and we say severe when the person is not yet on a ventilator but then needs a lot of oxygen. Okay. Okay.
So currently, do we have any?
So currently, there's 1 person on a ventilator and 2 who are having assisted ventilation. We call that CPAP. So currently we have 3 people in the intensive care unit, 1 on the ventilator, 2 assisted. The fund also put in place a recovery garden. So out here, the patients can come here and relax. Out here, the patients can have physiotherapy. I'm sure with time you may find some patients in the garden undergoing physiotherapy exercises as part of their recovery.
We saw the Most Reverend Palmer Backel do his short video from this garden.
Yes, so that is also helpful and helps with the recovery of our patients.
So you're not just in your room 24 hours?
No, we even have a corridor where relatives can come over and visit their patients who are here. We believe that as part of the healing process, where relatives can see their patients who are here, it encourages the patients and also encourages the relatives and demystifies the disease.
How has the experience been working in this facility?
Being here has been one of a million experiences that I've had. It's been worth it, I would say, because through this, I've gotten the opportunity to serve my country, to serve my people, and also to give off my best as I can, like I'm called to do as a nurse. It's been challenging, but it's been worth it.
What's been the most challenging of your experiences?
Covid-19 came in when we were not expecting it. So that meant we have to brace ourselves for whatever impact that it was going to have on us. At the same time, seeing people who came in because they thought they were coming for treatment and hoping to leave. But at the end of the day, we lost some due to the critical state at which they came with. It was heartbreaking because we were all hoping that at a point we will have the opportunity to save most of them.
So you lost some of your patients?
We did. Being an ICU, universally, we know it's a 50-50 chance. But here, by the grace of God, we've gone beyond that, though we lost a few. So I think, all in all, like I said earlier, it's been challenging, but it's been worth it.
You've made friends as well?
I did. A lot, yes. I had the opportunity to meet some of the honorables, some of the big people in town, and through that we've established contacts and made friendships. So I think this not only for GIDC, but it will go a lifetime. Yeah. Yes.
Well, you're very generous because when you come to the hospital, it really doesn't matter who you are. You are nobody really. But I also want to talk to you about your experience. You oversee the original GA East and this facility. Yeah. I have heard that a lot of the nurses want to work here.
It's true. You know, when you look at the structure, you know, working here is, they feel very comfortable, even the environment alone. gives you some sort of comfort. So at least everybody would like to work here, yes. Because, you know, some of the gadgets, they do not have some of the gadgets that they have here. They don't have them over there, especially the monitors. You know, the monitors help a lot. For instance, you may not, and then even with the control room, you may not be there with the patient, but with the monitors and then the cameras in the CCTVs in the various walls gives some sort of relief. So it's like all the time the nurses are watching, both the nurses and the doctors, they are watching the patients, their movement, whatever they want, and then they go in. Yes.
Yeah. How many nurses do you have under your control?
Currently, I have 175 nurses and midwives. Okay, in addition to about 30 CCNs.
Intensive care nurses.
Critical care nurses.
Critical care, okay.
Yes, but that is still not enough. We need more nurses and more doctors.
So when this place gets really busy, are you able to use all your nurses, your critical care nurses as well?
Oh, sure. We are using them. They are doing a wonderful job. They are working hard. But we will need more. Yes, we will need more.
Okay.
Yes.
Let me just ask Cecilia, how is your shift like? What's the craziest shift you've run on since we started recording COVID cases?
I think from the beginning to as we speak, it's been a daily dose of getting more hectic and getting more busy. I remember last week, the day team had to leave here as late as 10:30 p.m. We came in 8 a.m., we had to go 10:30 because our patient in the ICU, some were not doing well at all. Having to intubate, going in, inotropic support, sedation, it was crazy. Doing invasive procedures and all that. We really had a hard time on our hands. But at the end of the day, that patient that looked as if we're going to lose any moment is quite stable, though we're still on the life support. It's quite stable, and we are hoping as the days go by, he will get much better.
Okay. Let me just finally end with you, Auntie Mavis. Have you had some of your nurses get COVID-19 because they've been here and they've been working?
Yes. Some of them got infected. Yes. But they have recovered. Okay. Yes.
So you haven't lost anybody?
No, so far, we haven't lost any health worker working here. Right. But some got infected, all right. And then they have recovered and they are back with us.
Okay. But I also see that now we're all comfortable because initially, I guess, the fear of the disease, but now we are more in charge and we know how to handle it.
Exactly. Because now, you know, they've been trained on how to don, how to put on the PPEs, that is donning, and then how to remove, that's doffing. They've been trained properly on that, and then they are being trained day in and day out on IPC, that's infection prevention and control. So I can say that they are in control now. Yes.
Well, we thank you for doing the work that you do as we observe the 1-year anniversary. We wish you well, and we thank you for choosing to do this work. Without you, we will be nothing really, so thank you.
Thank you too. Thank you so much for the wonderful work you people are doing.
You are appropriately clothed. Mm-hmm. So you see most of the people out here are just wearing their scraps and their N95s on because they haven't gone into the patient rooms. If you have to go into a patient room, then you will change whatever you are wearing.
Okay.
So before the patients are also discharged, they come here, the doctors and nurses speak to them, tell them what to do when they go home, tell them about the medications they are discharged home on, then give them a form, we call the discharge form, has instructions on it and what they need to do just before they come back for a review.
Okay.
So once a patient is done, the exit is through another door. So currently we are walking in the corridor where everybody can walk, patients and doctors, nurses alike.
Okay.
So we are exiting the building. Okay. The exit is also controlled so that you can't come in from another side.
Okay.
So the flow, there is a flow within the building such that you don't mix dirty with clean. So once the patient is going out, we see that the patient is very contaminated because the patient has been in the dirty area.
Okay.
So you can see that there are markings on the floor that direct us as to where we need to walk. So the points to what we call the dolphin area. Remember I said donning. Donning is where you wear your clothes. Dolphin is where you take off your clothes. So this whole corridor is considered a contaminated corridor.
Okay.
So the patients will come in. If you're coming from the ICU, you will use this exit.
Okay.
If you're coming from the severe area, you use that exit. And then we all go to this room. So we are currently going out of the building. So exit to the outside.
Okay.
Your vehicle will be here.
Okay.
Whilst out here, the hygienist will then decontaminate
Oh, okay.
So your things, your luggage, your belongings will be decontaminated and put in the car.
Okay.
And for the patient, we usually wash your hands and your feet are decontaminated. Then you can sit in your car and go.
Okay.
Most of the time when the workers or the doctors and nurses have finished, their healthcare workers have finished their work, they come out here and then they go to what we call the doffing off process. So this is the doffing off area. So first, if you are wearing boots, so you step into the chlorine
Okay.
to decontaminate your boots. Then you go to this particular station where you go through the process of decontamination. There's somebody here always to take you through.
Okay.
Once you are done, you step over this box. The owners are all inside. With time they'll come out and then they'll decontaminate. You wash your hands and then you exit.
Oh, okay.
The other side.
Okay. I have to ask because you used intensive care or severe cases in ICU. What's the difference?
Okay, so ICU is anybody who needs assisted help to breathe. So either you're on a ventilator or you're on a machine that helps or augments your breathing. Yes, we can put you on oxygen, but then you need assisted forms so that we can increase your oxygen capacity. Those are the ones we put in the ICU, intensive care unit.
Okay.
I used intensive care unit and high dependency unit. Most of the cases in the high dependency unit and in the ICU are all critical cases.
Okay. All right. So this is also a place that not only the GIDC uses, but the original GAISTs.
The original GAIST has other places where they decontaminate. The GIDC kindly uses this place.
Okay. All right.
GAIST has been very generous by giving us some portion of their land so that we can also help fight. Remember, we still managing COVID together. They manage a lot of the moderate cases, and then the severe and critical cases are managed in the GIDC.
Okay.
So I want to take you to the post-COVID clinic.
Okay.
So we've gone through somebody who had come in, has been admitted, successfully discharged, has been decontaminated, has gone home. Is that the end of the story? No. For everybody who is discharged, we ask you to come back in a week to see how you are doing. And that's a review. We have noticed, and I'm sure you've all read, that people speak about post-COVID. And post-COVID, as anybody beyond 28 days after recovery, you still have symptoms of COVID. Okay. So we call that long COVID or the post-COVID syndrome. Because of this, we have a post-COVID clinic where our patients will come in and they are seen. We started this in June last year. So we've had people in the clinic for almost 6 months. We intend to follow up our patients for close to 6 months before we formally discharge them.
Okay.
That tells us or gives us an idea as to the effects of COVID on the body. Because remember, we don't know everything about COVID.
Sure.
So maybe let's pass through the post-COVID clinic. I spoke earlier about the oxygen plant.
Yes.
That together with the Ghana Health Service and the fund was given to us. So a Ghanaian company, Rick Air, put up this plant for us, and that has been augmenting our oxygen supply.
Okay.
So currently we do not have issues with oxygen, but the amount of oxygen that the plant can supply means that we can only do, let's say, about 25 severe and critical cases at any particular point in time. That is why the capacity of 100 bed is limited.
Okay.
Not because we do not have beds, but you do not have functional beds.
Okay.
You know, COVID, most facilities are built with oxygen supply systems looking at just about up to about 10 liters, 1/3. But in COVID, almost every patient is using about 3 times that amount of oxygen. And so there's no ready supply of systems that can produce the type of oxygen that we need for COVID.
Okay.
So even though we had a 100-bed facility built, you cannot run the place with severe and critical patients 100 at the same time.
Okay.
It will collapse. You won't have oxygen for them.
Sure.
So most of your patients will die.
Okay.
So we are being a little pragmatic in reducing the number of patients we see at any particular point in time so that our mortality will go down and our success stories will be higher.
Okay, great. But does this facility take a lot more severe COVID patients than any of the others that you mentioned?
Currently, we have 21 beds and another 20 beds. So we can do about 40 severely ill patients at any particular point in time.
Okay.
I must say that other facilities like Rage Hospital has taken a lot of the cases off us, but we still tend to move them around. Nyaho has also been very helpful in this regard.
Okay.
At the height of the pandemic, let's say in the second wave in February, then we had a lot of cases. Now the cases have died down significantly. We've been in operation since the 12th of January, and I must say that over the period we've seen close to 112 cases already.
12th of January 2021?
2021 till now we've seen a total of about 112 cases. Fortunately, we've lost about 10 over the period. But then we feel that our successes are what tells the story.
Absolutely.
Yes.
Absolutely.
Some of the cases we couldn't do much about. Others also from more of post-COVID complications. Yeah.
What do you think would have happened if we didn't have this facility?
Sometimes I don't want to think about it because then it means that our mortality rates or avoidable deaths would have gone high. There'll be too much stress on Kolebu. Rage wouldn't have been able to help because they wouldn't have beds. 37 was helping, but then they'll be overstretched. Nyaho will struggle more than is struggling now. So this facility came in to more or less help calm the waters. And I must say that even with this facility, we're still stretched. So if it hadn't been here, we would have had a horrible story.
Yeah. I have to ask about the generators though. How often do you use them?
So the generators come on when our lights go off. I must say that over the last week, is it Dumso? We can't say whether it's Dumso or whatever it is.
We know that Gridco, for instance, had a major issue.
Yeah, and the generators have come in handy. And I must say that we're just running out of fuel because it's been used more than we're expected to use it. The generator powers both the building and the oxygen plant.
Tell me you don't pay electricity bills, do you?
Nobody has sent us a bill yet, but I'm sure we will pay.
Thank God, because that's also one of the, we're advocating that nobody brings you the bill.
Maybe we need to speak more. So we're going towards the post-COVID clinic.
Okay.
In the GIDC, currently we have close to 20 doctors.
Okay.
At any particular point in time, there are 6 doctors on duty.
Is that enough?
For the number of patients we have and the work we do, it's enough for now.
Okay.
If the numbers increase, we'll certainly need more.
Okay.
So for the ICU always has 2 doctors and a consultant on duty.
Okay.
The main ward also has 2 doctors and a consultant on duty. So at any point in time, there are 6 people you can consult.
And you're doing 24 hours?
And they're doing 24 hours.
Okay, great.
And we do 12 hours during the day, 12 hours at night. So we think it's balanced. So during the day, there are 3 doctors. During the night, there are 3 doctors.
Okay. Did you have COVID disturbing you in terms of some of your team members getting infected?
Yeah, some of my doctors became infected. Some of my nurses were infected. Some of my lab staff were also infected. Some of my orderlies, those who clean the place, also got infected. So every healthcare worker, every cadre has been affected by COVID.
But thankfully, you haven't lost any person.
No, we haven't lost any. But I must say, there's one thing recovering fully from COVID. Some are still battling with the post-COVID complications. Yes, we didn't lose them, but they still have post-COVID complications.
Tell us about the experience working in the post-COVID clinic.
So first of all, post-COVID, just as the name indicates, is after you get in coronavirus, the cases that come after coronavirus. So people get coronavirus and then they get healed, they test negative. But then some of them end up with certain physical conditions that will seek or will need attention. So majority of the time we end up with people with pulmonary conditions, and currently we've discovered that people are discovering and getting kidney conditions as well in terms of getting COVID. Even young people who don't have certain conditions are now developing certain conditions such as hypertension, diabetes, not because maybe they inherited it from their family or because of their lifestyle, but because they had coronavirus. So these are some of the cases that we are dealing with currently.
Okay. So what typically happens? What do you do to such persons?
So we let them see a doctor, and then depending on their field of specialty, we'll transfer them to the place they are supposed to go. So somebody with a pulmonary condition sees a pulmonologist. And one thing we've also realized after COVID is we have a lot of people with psychological issues. People are developing depression, anxiety, post-COVID. So that's why we let you see a clinical psychologist or a psychiatrist, depending on the symptoms you are presenting with. And kidney, and we all transfer you to specialists. Some are Kolebu, some are Ridge Hospital. So that's what we do, yeah.
All right. So typically, how many people do you see coming to the post clinic?
In a day, we are seeing an average of between 20 to 22 cases in a day, yes. So that's the cases we are seeing currently, because I'm sure people from this facility who got COVID come here for post-COVID treatments, and others from other facilities also sometimes come here for post-COVID. That's what we do, yeah. So
this one is a bit more personal. How do you enjoy working in this facility?
It's surprising. I'm a nurse, so it's more or less like it's a call to duty. You're supposed to be here to work, irrespective of the conditions that you face. And Guy's Municipal, the nurses and the doctors and the medical team, it hasn't been easy, but it's more or less like they are dedicated to the work. So we've been putting our best and trying to do our best. I'm sure some people have good experiences with us, others don't. But whatever be the experience, bear in mind that we are dealing with a condition that is new. Most of us we've not even heard of it. It just came last year. Was it 2019? Yes. So we are still trying.
We started recording our cases in March.
In March, yes. So it's new and it is scary, and we've had losses. We've also had success stories, and with this place we are mostly dealing with the success stories. So it's more or less like a needle in a haystack, but we are just trying to survive. And we are hoping for the best now that the vaccines are in the country. So that's what we are looking forward to.
Great. Well, thank you for sharing your experience with us.
Thank you very much.
Do some of your colleagues envy the fact that you're working in GIDC?
Oh, trust me, I tell you, there's so many people who don't even want to be in this environment.
Oh, for real?
No, I mean, come on, it's COVID. And so, you know, the perception and the stigma, that's why I'm saying that the medical and the nursing team currently on the ground have done excellently well, yes.
Absolutely.
It's not easy working in an infectious environment, so that's it.
Okay, Dr. Kome, we're coming to the end of our tour, but I see that you also have a very cute ambulance.
Yes, it's donated by the fund.
How useful has this been?
We've used it once or twice, just for internal purposes. Externally, we haven't moved any patient anywhere. If we have to do anything, National Ambulance does that for us.
Okay.
In terms of maybe getting the patient to go and do a CT scan in UGMC, the National Ambulance will call to do that.
Okay.
Yes.
All right, great. So, do you need an ambulance?
We need an ambulance, a bigger ambulance. This might suffice for most of the young children, but we haven't had any difficulty with any young child at the moment.
Okay.
But then for the adults, we think that we need a bigger ambulance.
Okay, great.
Yeah.
As we wrap up, I want for you to give a few tips for people who are preparing to take their jabs. Those who have taken the vaccines have reported of fever in some cases. People have been restless, headaches, and that would scare some other people. But what do you have to say to persons?
I must say that as part of the vaccination drive, we told people that there are some side effects you expect. And these side effects are normal and generalized to any new thing you're introducing into your body. Let me start by saying that once you put in a vaccine, you are telling your body to react as an inflammation. With inflammation, the key responses to an active inflammation is a fever. So you have a high temperature. You have the place becoming red. You have the place swelling up. So all these things people are experiencing is just because they have introduced something new and the inflammatory process is ongoing. So how do you deal with the inflammatory process? You can't stop the inflammatory process. You can minimize the untoward effects of the inflammatory process. So if you take a jab with inflammation, you may get fever. So you can take paracetamol, let's say 2 hours before you take your jab, so that by the time the effects of the jab starts, you already have a baseline. So you may get a fever, but instead of recording 40, you may be recording 37.8. Okay. And that is not a great fever. So you can take your painkillers or your paracetamol 2 hours before the jab, and that helps minimize it. And some people just take the paracetamol before, and that is a no. For over the next 48 hours, usually paracetamol is taken every 8 hours, or for some people every 6 hours. Do that over the next 48 hours, and you may go through without any symptoms.
Okay.
Having said that, we all may react differently. If you feel that this reaction is too uncomfortable, please go to the nearest hospital. Let them know I took a jab and this is how I'm feeling, and then you will be sorted out. If you feel you can, as a diarrhea, take ORS. 2, 3, 4 times ORS will do. If you are doing more than 5 times, go to a hospital, so that maybe apart from rehydrating, you may be given a drip just to keep you strong. If for any reason you start behaving abnormally following the jab, your relations should move you quickly to the nearest hospital. Okay. So yes, we may experience, we may not experience. I personally had headaches and a fever, even though I took my paracetamol and took it religiously. I'm sure if I hadn't taken anything at all, mine would have been very severe. But because I had a grounding or a baseline, I was fine.
Okay.
And I've advised that everybody should go out for the vaccine. If we have the critical mass vaccinated, maybe soon we shall have to take off this thing, and I can see your face, and then you can see my face when we have interviews.
Absolutely. Well, Doc, thank you so much, but I can't end this without asking your personal experience working in this facility.
Well, Mama V, my whole life, growing maybe over the last 6-7 years, I trained to be an infectious disease specialist. So COVID, Ebola for me means that I have work to do. If it has to do with heart, I'm sure Professor Frimpong Boateng has work to do, and I'll be relaxing. So once we have a pandemic, it's time to work. And I've been giving my all for this, because this is my time to work. After the pandemic, others will be working. I may be resting. Maybe you hear that I've gone on a 2-year vacation, because I believe that over the last year, I have worked enough so I can take a 2-year vacation. So for me, this is what I have been training for, and this is what I am doing. It's like a soldier who prepares for war, and there's war, and the soldier says, why is there a war? You prepared for a war. So
you say bring it on.
Bring it on, and we shall do that way.
Yeah, but I'm just thinking, so you're an infectious disease specialist, but we didn't have an infectious disease center.
Yes, so for me, this is great joy. I used to work in Kolebu, moved on to Lekma Hospital, and once this place was built, I was asked to move here. I said, good. It's an opportunity for me to practice. Today is for COVID, but because it's an infectious disease center, I know that very soon, if there are other pandemics, Ebola will bring it here, yours will bring it here. It might make me practice better infectious disease, and I'm happy about it. And I really want to thank the people of Ghana, because through the private sector fund, they donated money, and we want to assure them that their investment will be looked after well, because that is the key thing. I also want to encourage those of my friends in Kumasi, when the private sector fund comes over to Kumasi people, I know how you do it. Give them the money so that they can build a center like this in Kumasi. Thank you.
Thank you so much, sir. The story of Ghana's first infectious disease center is not complete without those who first came together to have that dream. And that's why I have come to speak to a co-chair of the Ghana COVID-19 Trust Fund, Dr. Otim Jesse. Thank you, sir. So we've taken a look at the infectious disease center, the very first of its kind that we have in Ghana, thanks to the fund. I want to ask what you make of how it is being used today.
In one word, I would say that it has been a godsend. Because if we look at the fact that towards the end of last year, the pandemic seemed to be slowing down, and we're all thankfully happy that we may never need it as much as we thought we would. Then all of a sudden, the second wave struck, and it became imperative and became urgently required. And I think that from all the information and the news we get, it has really been a godsend.
Are you still involved in the facility?
Involved, not in the running of the facility. We handed it over to government, the Ministry of Health, the Ghana Health Service, I suppose. But we, from time to time, if there are any difficulties or requirements, especially consumables, the fund is always ready and willing to assist.
A little bird told me this morning that you're also considering setting up a management fund.
Yes, we are considering looking at a way in which we not only make it sustainable, as it were, but also make it sustainable in its most effective way. And we think that it would be useful if we could get donors together and set up a fund which will go along to help from time to time. So whether the trustees are there or not, it means that it will still work well. Of course, there is one difficulty, and that's the difficulty of when you start singling out areas like that, you know, then what happens to the wider health service, the wider number of people who are providing important services in COVID? So it's a dilemma we have to face, and at the same time, I don't think it should stop us from doing what we can in order to keep this initiative going.
Big question, when are we seeing the fund go to the other regions?
Yes, the original plan was from Accra to go to Kumasi, and then the northern region and the western region, not necessarily in that order. But Kumasi was set to be the next one. And I think that discussion is going on. We would dearly love to do one in Kumasi, because I think that the second half of this country needs an infectious diseases center of that kind. And maybe even it can be bigger or better. I mean, the experiences we have learned from this one could very usefully be put in the next one.
So just finally, when you look back, and this is a personal question, do you feel proud of yourself that you were part of this project from the beginning, or what's the feeling like?
I am thankful to God, I mean, to be sincere, that a group of us got together and had the brain wave to do this. I mean, and I keep wondering that what is it which got into us, because in the beginning we just thought that if we put in 100,000 cedis each year, we have done, you know, but the ambition to do something even more permanent, I think must have only been God inspired. And so, yes, I'm glad, I will say, but I'm very thankful to God that we've done this.
Well, we thank you for starting this.